Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Roush. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Thanks for joining us today for Scrub In. Thanks for our return listeners. And if you're new, welcome to Scrub In. I'm Alice and this is Keisha. Today, we have lots to talk about today, including obesity and weight management.
It's going to be a great topic. And as you know, we start our podcast with a quote. And so here is our quote for today. Take care of your body. It's the only place you have to live. And that's by Jim Rohn. Isn't that so true?
That is the perfect quote for our topic, the obesity and weight management. Today on the show, we have Dr. Goparaju. Thank you so much for joining us today.
Thank you so much for having me.
We are going to get to our topic about obesity and weight management, but first, introduce us to you and welcome to Bay Health. You've been here about a year and a half.
I have, thank you. So I go by Ani. Ani Goparaju was my name, basically. I grew up in Houston, Texas. I was born in India, but I moved here at a very young age. And I stayed there through basically from K-12 all the way through the end of medical school, and then had a shift into New York where I did my training. I trained at in the South Bronx for my general surgery residency. I did my fellowship in minimally invasive surgery and bariatric surgery at NYU Long Island in Mineola, New York. And I stayed there as faculty for several years, where I worked in general surgery, trauma surgery, and bariatric surgery. After I left New York, I spent some time in the South, decided I wanted to come back up north, and found my way to Delaware, to you fine people. I have a 2-year-old son. I have 2 lovely dogs. I live down by the beaches in Lewis, and life's great.
Awesome. Well, welcome to Delaware.
Yeah, we're so glad to have you. Tell us a little bit about growing up in Texas and what became your why for getting into healthcare.
Yeah, Texas is a very unique place, and and Houston has become a international city, when before it was maybe a moderate-sized city as I was growing up, but right now it's really an international city, a foodie city, and unfortunately, Texas and Houston is probably one of the largest cities in the world, meaning the highest, one of the highest rates of obesity. It's unfortunate, but it's the reality. There's so much sprawl. There's so much distance between places. Everyone's driving. There's not many people walking, and so that and delicious food definitely does not lead to an active lifestyle for a lot of people. Growing up in Texas is great. You can cook an egg off your car in the summertime, but it just never felt like home after I left, and so it's nice. It's nice to go back, visit family, but I think I just enjoy the Northeast coastal life.
And you were exposed in Texas then to seeing people who were dealing with obesity and health issues. And did that get you excited to pursue a career in healthcare?
Believe it or not, when I started medical school, I wanted to be a neurologist.
Oh.
And I love the idea of studying the mind. The practice, however, I found did not scratch the itch that I had. I'm someone who really enjoys working with their hands, solving a problem, and also, helping bridge the gap and helping and improve healthcare outcomes in that way. I didn't know I wanted to become a bariatric surgeon until I was a bariatric surgery fellow.
Wow.
And I say this because it is my passion now, and I can speak frankly and honestly about this. I wanted to use the principles of minimal access surgery and robotics to improve patient outcomes. And like it or not, they go hand in hand, because some of the patients that would benefit the most from minimal access surgery, laparoscopic advanced techniques, and robotics are patients who are more heavy set, who do struggle more with abdominal obesity. And that's just because open surgery in those patients is just that much more dangerous than for someone like any of us in this room, and so during my fellowship, that's when I really discovered and like, oh my God, I can make a huge difference. I can help patients in a way that, we've barely scratched the surface of. You have preventative medicine, right? You have preventative health care to prevent complications, prevent issues from getting worse. Bariatric surgery is the closest thing we have to preventative surgery.
That's absolutely fascinating. I mean, for you to go from one specialty to another and really find your niche based on the technology and being able to offer minimally invasive solutions and surgery, that's absolutely fantastic. So kudos to you for doing that and making that pivot midway through your fellowship there. So that's great. So now that we've established and got a little bit of background about who you are and why you do what you do, what are, you work with patients who are a little bit more sedentary than most probably. And so how do you keep yourself healthy to make sure that you also don't walk down that path?
Oh yeah, absolutely. So, believe it or not, I have also struggled with weight a lot in my life. And so, I know better than most, it is a lifestyle change. And so what it comes down to is the mind-body connection, and what I tell patients is the surgery is a little tool. Patients will succeed when they use the operation as a part of a mode towards a lifestyle change. But I could do an operation on you tomorrow and it would not work, And so as an aside to that, what you were asking, to answer your question though, I walk my dogs. I try to be pretty consistent about that. I try to ride my bike whenever I can. I used to hike a lot, and I'm trying to get back in that now that my son's a little older and he can actually maybe follow me around. But you really just got to keep moving. In my younger days, I would do some more, weight training. But that to me, as far as that goes right now, that's something that is an aspiration of mine to get back into. But as far as I'm concerned, my goal is to keep moving. The other part of this is in the kitchen, right? And so where that goes in, like every single decision matters. Like if you're gonna, every single decision matters. I should rephrase. Every single decision matters in the grand scheme of things. Meaning, if you indulge one day, you better not indulge the next. I had a piece of chocolate just now, but that means I'm not going to do that again for a few days.
Wow.
But you know what I'm saying? Like, it's just kind of, if you eat something heavy, you got to balance it, right? And so it really, really goes into it. And like every single decision matters. If you make a decision, then you have to own up to it.
Yeah.
Right? And it's about being honest with yourself, and that requires mental clarity and finding ways to not allow food to become a sort of crutch. Because a lot of patients do struggle with that.
I was thinking when you said neurology as, something you were thinking about and then ending up in bariatric surgery, there's a lot of talk now about that mind-body connection and gut health and how it impacts, your brain. And as you're working with patients, I know one of the big things we talk about is that behavioral health aspect and working through not just what we can do the surgery, but how do we get you to a place mentally where you're ready for the surgery? Can you talk a little bit about like what the prep is to get to bariatric surgery?
Absolutely. So, grand scheme of things, it takes on average between 6 and 9 months to get to weight loss surgery or bariatric surgery from the initial consultation. We have our you have an educational video that typically any program would have, and that's kind of an intro. This is what we do. This is what you have to do. If you're interested, come, and then we have an in-person consultation. The workup, there's a few medical things, an endoscopy to like take a look and see what operation you may or may not be a good candidate for. And then there's also the educational component. I think the educational component is huge. And depending on the program, you'll have a large component of, there's a 4 month thing where you're just kind of immersing yourself in information and learning about different things, talking to different people through the support groups. And there's also a psychological evaluation. And what I tell my patients is they're not trying to get your deepest and darkest secrets, right? It's literally, hey, do you know why you're doing this? Is there anything we can do to help you in your journey? And the other thing is we want to make sure we catch anything like eating disorders or anything like that, because that would really become a challenge if you had a surgery, if a patient had a surgery and they had an eating disorder. But all in all, to answer the question of the mind-body connection, there's a lot of research going into that right now. There is a lot of new information coming out, and there is a limited time in a patient encounter, right? And so a lot of what I do is like I raise the questions, spend as much time as needed, right? But I'm like, hey, these are your resources. These are what I see as your potential triggers from our conversation. And this is what you need to work on. And, as they proceed, and as long as the patient is in their own, operating in good faith, rather, then they'll do it.
So there's a lot of commercials out there, helping to, help people with their weight loss goals and kind of being their best selves and looking their best selves. And I see a lot of commercials around like Ozempic and Wegovy and all those kind of weight loss opportunities. They're weight loss drugs. If someone was trying to weigh between whether or not they should take those kinds of medications versus having bariatric surgery, how would they go about making that decision? What's the best candidate for each one?
Thank you. That's a great question. The weight loss medications are phenomenal drugs, and they have great outcomes early on. We're still waiting to see long-term data, 10, 15, 20 years out. The other portion of that that I think is less talked about is the fact that every week a patient has to be consistent about making that decision. Do I take this drug? Do I take this shot? No, I have to inject myself. You can say, oh, it's like insulin, you got to do it every time. But it's also a decision. And it can become a challenge. The use of GLP-1s or weight loss medications does not prohibit bariatric surgery. As a matter of fact, there is a reason to use it to get someone down to a more safe operating weight. There is a reason to use it when patients have already had weight loss surgery, and the rare incidents that they do regain some weight, whether it's due to a complication or, they come to me 20, 30 years later and have some other issue. Steroids can do that kind of stuff. Life happens, right? And so there's definitely a use case for GLP-1s in that situation. I think they are more different options where one may be good for one patient, another may be good for another patient. The surgeries, it's not a one and done thing. It is an operation, right? It's a big deal, right? But to say that, hey, I have this operation, I'm good, it's not. And come back to that, every single decision needs to be made with deliberate practice, right? And so that's what it comes down to. And so if someone is interested in changing, this is a life-changing thing, then, we can help.
Well, once they make that decision to have surgery, what qualifies them to even ask about it? Is it like a certain BMI, or just how do you know that you should inquire
About weight loss surgery.
about weight loss surgery? Yeah.
So typically someone with a BMI over 35 with comorbidities such as diabetes, blood pressure requiring multiple medications to control it, heart disease, cholesterol issues, liver disease, thyroid disease, sleep apnea. It's not all inclusive, but a BMI 35 with multiple comorbidities, or a BMI of 40 or more. And if your BMI is over 40, then it does not really require comorbidities to qualify for the insurance.
So I know, having bariatric surgery, I have a couple friends who've actually had the procedure done or surgery done, and, they look great and they're very happy that they did it. But I'm wondering, what are some of the long-term results from it? How does someone maintain that weight and maintain kind of what the early results that they've achieved right after the surgery?
Oh yeah, for sure. When I talk to patients about this, one of the things you'll hear me say is, you're gonna feel great and you're gonna lose weight no matter what you do in the first 6 to 12 months. During that time, you use this, we call it a honeymoon period, to establish those good patterns, good practice patterns, and then you continue that over the course of your life, develop those good habits, so you don't have to constantly make a decision, right? Initially, to develop a habit, you have to make a practice. Eventually, that habit becomes second nature. But to get there, it takes time, right? And that's our goal. The surgeries do a lot in the sense that they actually help restrict how much someone is able to eat. They help change the absorption so they're able to absorb enough, but not too much of what they eat. And on top of that, it changes the hormonal composition of the body to facilitate weight loss as well.
So just a follow-up question. That's great that it does those things for the body. Are there any other overall health improvements that someone who has a surgery can expect?
Absolutely. The surgeries help so much in resolving comorbidities. There's different nuances for the different procedures, of course, but bariatric surgery is shown to reduce sleep apnea. It can cure diabetes. It can reduce cholesterol, reduce the chronic back pain some patients have, joint pains. It can change someone's life. I remember a patient. It's someone I've kept in touch with periodically, but someone I operated on when I was working in New York many years ago, and I met this person through the ER. And they were struggling with their breathing, and I met them for an emergency general surgery procedure. I told them, listen, we need to do something. You may not survive 5 years where you are right now. And this person was nearly 500 pounds at the time. They had an infection. I took care of the infection. And that really got to them. And they went through the procedure. And they struggled initially, but 500 pounds became 400, 400 became 300, 200 became 250, and then 230, 220. And, they went from their BMI was in their 80s, now down in the 40s or 30s, and still progressing. And so that is someone that is inspiring to me. I tell this story not too frequently, but, this is someone who has been consistent, really cares, and just changed their life around completely just because, and they needed help, and they were brave enough to ask for it.
Yeah,
a lot of courage, definitely. So what should folks know about what life will be like for them after surgery? What are some things that they should look out for, either them or maybe their caregivers or their spouses or whoever they happen to be living with?
Definitely. So patients can expect to stay in the hospital for 1 to 2 days after surgery, and then they go home. And, it used to be that patients are expected to lay in bed after surgery to recover. That's the exact opposite of what we want here. I want patients moving and, active as best as they can. Even day 0, when you're in the hospital the night of surgery, I want patients moving around and walking around the halls. And that really helps move people forward, right? Patients might expect that their taste buds might change. They might expect to feel a little sore, right? They might expect that they will not be able to eat and drink it the same way they used to. The general surgical principles aside, I think there are certain things as far as diet that need to be watched for. I recommend patients do not mix solids and liquids in a meal. If you eat something, wait 30 minutes before you drink something, or vice versa. I recommend avoiding carbonated beverages weight loss surgery, and just because that can cause bloating and problems and heartburn and all sorts of challenges with digestion. And so, the very key thing, especially early on, is just focusing on staying hydrated, because that's going to be that critical time when everything is healing up. And so just, if you're able to stay hydrated, you're going to heal.
That's great. I know we all have to drink more water. So various things. So not just from bariatric surgery, just drink more water so you can heal. Cheers to that.
What would you say to someone who's considering surgery but nervous to take that first step?
I would say that it's important to talk to your physician about it. And talking about something is the only way to really move out of that feeling of anxiety and nervousness. Because the idea is just that, it's an idea, right? Nothing has been done, right? And so it's always good to weigh your options, and if you're interested, make a consultation, and we can talk. That's really all it is. It's a conversation.
Do you hear stories about what made somebody make that decision as the physician? I remember recently hearing a story of a woman who said, I couldn't get on the ground and play with my kids, or I couldn't run with them, and that was the moment that I decided I want to get this surgery. Do you hear other similar stories?
I do. Someone who's had a passion for bike riding their whole lives, and they couldn't do it anymore because of a new health concern. I had another patient who couldn't play with their grandkids for that reason. They wanted to be around for their kids. I hear that a lot. Some people are they've tried it all, and they're telling me, I've struggled my whole life. Enough is enough. I need to do something different. And, all of them are very reasonable. And I think the key here is it's a human connection, right? Like, this is how we live our lives. And the idea of surgery, weight loss surgery, is to allow a person to live their life in the way they want. It's not about making you look better, although that might happen, right? It's about allowing you to live a healthy life.
That's fascinating. I personally, if I was going to have it, I would want to look better, but that's good to know. It's like, that's not the only, that shouldn't be the only reason that happens. So I'm just curious though. I know with individuals who go through the surgery once, have you ever had patients come back and say, hey, I need a revision or something? I'm not needing another opportunity to kind of get on the right path of weight loss and health.
Absolutely. Revisional surgery is definitely something I do, and a lot of other surgeons here do. And that's one of those things, which is a case-by-case basis, but it definitely does not disqualify someone from having not a redo operation, but a revision. Sometimes revisions are for issues that developed over time with the previous operation. Sometimes it is for weight regain, because as we all know, life happens. Yeah.
Absolutely. Well, if someone wanted to get in touch with you or your team for a consult, how would they do that?
I think the website is bayhealth.org/lose4good.
I love that, Lose for Good.
And then my offices are in the Bay Health Milford General Surgery office on the second floor in the Milford campus. My colleague, Dr. Katsikis, is at Bay Health in Dover at the campus. And so, both of us are taking patients.
Fantastic.
Thank you so much. Thanks so much for sharing so much information, important information on weight loss and even the surgery as well. And thanks to our listeners for joining us today for Scrub In.
Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.